Hello friends, I am Pradeep here. Now we will discuss about skin grafts. Let's have a look at the anatomy of the skin. The skin is formed of two layers. The outer layer is the epidermis and the inner layer is going to be the dermis. And the dermis is further subdivided into papillary and reticular dermis. With regard to skin graft, what we are more concerned is where the skin appendages are located. The skin appendages like sweat glands, sebaceous glands, are located in the deeper in the dermis, as well as the blood vessels as well as the nerves are located deeper in the dermis. So whenever you are going to take only the epidermis, you are less likely to have sensation because the nerves are not included, less likely to develop hair because the hair follicles are not located in the epidermis because they are located only in the dermis, and there is less likely to have sensation as well as relation to temperature like hot and cold. Everything will not be there when only a epidermis is being harvested. So moving on to the definition of the skin graft. Skin graft is nothing but a part of the skin which is harvested from one side without a definitive blood supply. A graft is nothing but which does not have any definitive blood supply, whereas the flap will have a definitive blood supply. So how does this graft survive? It derives blood supply and nourishment from the recipient area, like where it has been placed, right? So this picture shows this is a skin graft which has been meshed as shown here. Okay. So where do we use skin grafts? The common indications being mostly a raw area. The raw area as we described in the ulcer chapter. So you can recollect this image. So this is a granulation tissue post debridement status. Post debridement means you are removing all necrosed tissues. And the next one is post surgical and post traumatic. So this picture, the picture number 1 shows there is a squamous cell cancer in the knee region. So this has been resected. So now we have only the muscular bed that is shown here, upon which a graft has been placed. So post surgical resection, you can use a skin graft provided where you are not planning for any radiotherapy. If radiotherapy is planned, you should always reconstruct that area or cover the defect with the flap and not the graft. So what is the prerequisite for the skin graft? So first there should be a healthy granulation tissue as shown in the previous picture, and there should not be any bones, tendons, cartilage or nerves which are exposed, like a bone without a periosteum, tendon without a paratenon, cartilage without a perichondrium, nerves without a epineurium should not be covered with the skin graft, because the graft won't take place. Only the periosteum, paratenon and perichondrium will have blood supply, only then a graft will take. And there should not be any growth of any organism, particularly this beta hemolytic streptococci. If you place a graft and you open the graft after 5 days, that is going to be the first look, the graft will get totally lysed by this beta hemolytic streptococci. So there should not be any active infection and there should be a healthy granulation tissue for the graft take to happen. So what are the types of skin graft? There are two types of skin graft. One is going to be a split thickness skin graft. Another one is going to be a full thickness skin graft. The split thickness skin graft is nothing but where you will remove the epidermis fully along with a part of dermis. Epidermis plus part of dermis. In full thickness skin graft, you will remove both epidermis and full of dermis. Full of dermis will be removed along with epidermis in a full thickness skin graft. There are special names for these grafts, like a split thickness skin graft is called a Thiesch graft and a full thickness graft is called a Wolfie's graft. There are various types of further subdivided into the split thickness skin graft, further subdivided into depends on the thickness of the dermis it has been harvested, like a thin, intermediate and a thick split thickness skin graft, whereas a full thickness skin graft you will remove the entire of the dermis. So if you look at this image, these are the sweat glands, these are the hair follicles and the sebaceous glands, etc. In a full thickness skin graft, there will be more dermis, entire dermis will be peeled off along with the sweat glands as well as the hair follicles. So full thickness skin graft will have sensation, will develop hair, and will have sweat. Okay, so where do we harvest these skin grafts? Split thickness skin graft can be harvested anywhere, like the common places being the lateral aspect of the thigh, anterior and posterior aspect of the thigh, etc. Whereas the full thickness skin graft usually they get harvested where the skin is very loose, like eyelid skin, upper eyelid skin. So the skin will be very loose. Okay, so the eyelid skin, prepucial skin, and wherever there are any crease, like a nape of neck crease, there is an elbow crease, there is a groin crease, wherever the creases are there, there will be full thickness graft can be taken. So how do you harvest a skin graft? So to harvest a skin graft, you need to have a special device called a Humby's knife. So this is a Humby's knife, and you need to place a blade between this, that is called a Downey's blade. So as shown in the picture 1, so this is the lateral aspect of the thigh, wherein the traction and the counter traction will be placed with the help of a wooden logs, and the Humby's knife is used in a manner to form the forward and backward motion along and the tangential motion to form a to harvest the skin graft. So upon harvesting, what you will do is you will undergo meshing. So the meshing with the help of a mesher. Okay, so you can make direct strokes with the help of a level blade, or you can use a specific device called mesher to increase the surface area of the skin graft that has been harvested. So this is an example of the split skin graft that has been harvested. So this brown is only the epidermis, whereas the white has dermis. So this is a split thickness skin graft. Whereas in a full thickness skin graft, you will see some fat particles. You will see some fat because you are removing the entire dermis of the subcutaneous tissue. So the full thickness skin graft will have some of the fatty layer. So how does the donor area of the split thickness skin graft will look like? There will be punctate hemorrhages in the donor area. There is a punctate fine hemorrhages in the donor area. That means you have gone up to the level of the superficial dermis. If you have taken the entire dermis, you will see only fat. Okay, so the donor area of the split thickness skin graft can be left alone to heal, whereas the donor area of the full thickness skin graft should be primarily closed. And the second image shows the graft being placed over to cover the raw area. So what is the phenomenon of graft take? So the graft take usually undergoes three phases. The phase 1 is going to be the phase of plasma imbibition. Plasma imbibition, as we saw in the previous picture, once the graft has been placed, the initial 48 hours, that is 2 days, the graft will be in this phase where the graft will get nutrition from the plasma exudate. Once we scrape off the granulation tissue and place the graft over the granulation tissue and fix it with the help of a sutures, the graft will get the blood supply from the plasma exudate. So plasma nutrition, plasma exudate will nourish the graft. So after a period of 2 days, slowly there will be angiogenesis. Like angiogenesis is nothing but the production of blood vessels. The angiogenesis, this is the graft, this is the granulation tissue. There will be new blood vessel regeneration from the donor area, from the recipient area, as well as from the graft. So this phase is called inosculation. There will be blood vessels from the graft and as well from the granulation tissue, and they will be kissing together. That is called inosculation. So this takes place up to 3 to 5 days, and between 5 to 7 days they will get revascularized. So graft gets the complete blood supply from the granulation tissue at the end of 7 days, right? So the final phase is organization because of the fibrin clot formation between the graft and the recipient area, that is a granulation tissue. The graft will get fixed, that is graft fixation will occur. So this usually takes place between 10 to 14 days. So that's why we do first look, that means after complete dressing of the graft, we will open the dressing after 5 days. That means the first look usually takes at 5 days, because if we remove earlier there will be some movement of the graft, so the angiogenesis will not have takes place and the graft chances of graft failure is going to be much higher. So that's why we take first look at the end of 5 days. So the common complication is graft failure. One graft failure can occur if infection is not controlled, particularly beta hemolytic streptococcus. Another one is because of the seroma or hematoma. So this is the granulation tissue. This is going to be the graft. When there is any collection between the graft and the granulation tissue, the collection being either a seroma, that is a plasma exudate, or a hematoma, the graft and granulation tissue won't get fixed. So that in that way the graft will lose its blood supply and finally it will become failure. So to prevent the plasma exudate, because of the first 42 days we are doing that meshing. So the meshing allows the plasma exudate to escape through the holes, thereby preventing the graft failure. So finally we will look at the advantages and disadvantages of the split thickness as well as the full thickness skin graft. So the advantages of the split thickness skin graft being, it can be harvested anywhere, and since it can be harvested anywhere and it can be meshed, it can cover larger area. Since split thickness skin graft does not have much of dermis, the graft take will generally be good. So take will be better. Even in imperfect locations, the graft take will be better compared to the full thickness skin graft. And the donor area can be reharvested from the same site, because the donor area reepithelializes in 21 days. As I already described, the donor area can be left alone to heal by itself. Because we are removing only a part of the dermis, the reepithelialization occurs from the dermis to cover the skin. So the the graft can be reharvested from the same site at the end of 21 days. When you look at the disadvantages, the split thickness skin graft does not have any appendages like sweat glands, sebaceous glands, nerves, blood vessels, etc. So they don't have any, they cannot preserve sensation, so they are not functional. Plus, because of the most prominent secondary graft contracture, we should know about secondary graft contracture. One graft contracture can be classified into two ways. One is going to be the primary graft contracture. It's because of the elastin content in the dermis. So as we are removing more and more of dermis in the full thickness skin graft, primary graft contracture is going to be more with full thickness skin graft. Secondary graft contracture is the contracture that happens during the process of wound healing. So if you recollect the wound healing chapter, we described skin graft is a type of tertiary wound healing, or a wound healing by tertiary intention, or a wound healing by delayed primary healing. So this once the graft has been placed over the granulation tissue, the wound healing mechanism will cause the graft to get contracted. That is due to the myofibroblastic activity. Myofibroblast that is occurring in the wound healing will cause secondary graft contracture. Because of the myofibroblastic activity, the graft will contract in size and thereby it will also form an abnormal pigmentation leading on to a pore cosmesis. These are the disadvantages of the split thickness skin graft. Coming to the full thickness graft, so full thickness graft, we know it gives good color match. There won't be any abnormal pigmentation. It will be very much cosmetic. Since it has the appendages, it can preserve sensation, sweat, temperature as well. It can grow hair. But the disadvantage being, you cannot harvest large amount of full thickness skin graft because they have to be closed primarily. So the donor area requires closure, so it cannot cover large areas. There will be more primary graft contracture. If you take a 4 by 4 centimeter area of full thickness skin graft, immediately after harvesting it will become 3.8 cross 3.8. Because of the more of the elastin content in the dermis, the graft will undergo contracture, and the take will be relatively poor compared to the split thickness skin graft because it has larger amount of dermis which needs more nourishment. Okay. So with this we will discuss the skin graft with some MCQs. Then moving on to the first question, the following are true statement regarding the Wolfie's graft except. So what do you mean by Wolfie's graft? Wolfie's graft is a full thickness skin graft. So skin graft full thickness will preserve sensation, that is true. It is cosmetic, that is true. It can be reharvested from the same site, that is the false statement, because only the split thickness skin graft can be reharvested. Here entire dermis has been removed, so there is no chance for reharvesting. Primary graft contracture is more because of the more elastin content that is present in the dermis. Moving on to the second question. Following split thickness skin graft, the graft can be reharvested from the same donor site after how many days? The answer is 21 days. The third question is true statement of the following. Full thickness skin graft has more secondary contracture. Ideally, split thickness have a more secondary contraction, that is a false statement. Primary graft contraction is due to the elastin, that is a true statement. Full thickness graft take is better than split thickness, that is a false statement. And split thickness graft preserves sensation, that is also a false statement. Now moving on to the final slide, we will end this chapter with few one-liners. The primary graft contracture is due to elastin content that is present in the dermis, whereas the secondary graft contracture is due to the myofibroblastic activity. And what is the name of the split thickness graft? That is going to be a Thiesch graft. What is the name of the full thickness graft? That is going to be a Wolfie's graft. What is the most common cause of graft failure? It's going to be a hematoma or a seroma that occurs beneath the graft as well as the granulation tissue. Which organism is contraindication for grafting is a beta hemolytic streptococci that is responsible for graft disappearance take the once we see on a first look if the infection is going to be positive for this organism. Thank you.